Singapore has pledged its strong support for the World Health Organization's new Global Diabetes Compact, an international commitment to tackle diabetes. Speaking at the virtual summit, Singapore Prime Minister Loong says tackling the disease is a major priority for the country, with 1 in 3 Singaporeans expected to develop diabetes in their lifetimes.
Diabetes is an invisible disease. It does not appear as a top cause of death. But many heart attacks, strokes, and kidney failures, in fact, trace back to diabetes. Diabetes also complicates the treatment of many other diseases, including COVID-19.
Singapore declared war on the disease 5 years ago, and there is now a mandatory grading and labeling of ready-to-drink beverages. Advertisements for drinks high in sugar content are banned. A national screening program is also in place to help detect the disease early.
For more, we're joined by Associate Professor Bee Yong Mong, Head of and Senior Consultant for Endocrinology at Singapore General Hospital. He's also a member of the MOH Diabetes Prevention and Care Task Force. Thanks for joining us this evening. Firstly, the last we heard, there could be 1 million diabetes patients by 2050, but since then the country's waged a war against the disease. Give us a sense of who's winning.
I think it's a bit early to say who's winning. It's going to take a few more years. But I think Singapore has done extremely well in showing commitment to tackle diabetes from all fronts. And I think we are on the right track from the increased awareness of the condition through the various health programs to the national screening effort to pick up diabetes at the early stage, and the series of governmental policies and initiatives to encourage Singaporeans to adopt healthier lifestyle habits. So I think we are in a much better position now compared to 5 years ago.
Professor, help us understand, controlling diabetes, why is it so hard?
Indeed, it is hard not only in Singapore, but around the world. We are still seeing rising prevalence of diabetes in Singapore. And as rightly mentioned earlier, 1 in 3 Singaporeans will be expected to develop diabetes in their lifetime. I think 2 important factors to consider here. One is our aging population. Based on local data, it's estimated that by 2035, about 32% of Singaporeans will be age 65 and above. And I think age is a very important risk factor for the development of diabetes. The second factor to consider is the rising obesity rate in Singapore. We have still not managed to tackle obesity on its own, and obesity itself is, again, a very important risk factor to diabetes. So both these put together, I think, make it even more challenging for Singapore as well as other developed countries in managing diabetes.
And Singapore has taken many steps, though. For example, nutrition labels on packaged drinks, they will be a must from the year's end. How far do such efforts go, though?
I think as a standalone effort, it may have limited effectiveness, but we need to view this as part of the entire package, as part of all the initiatives that have been introduced so far. I think the introduction of the labels on the sweetened beverages hopefully can nudge Singaporeans to consume less sugar along the way, and hopefully with that comes along the other beneficial health-seeking habits. In that way, hopefully we can slowly sort of reduce the prevalence of diabetes in Singapore.
And I mean, there's also, this idea that as long as you cut out sugar, as long as you cut out carbs, you are sorted. I mean, is that right?
Consuming sugar on its own, I don't think it leads to diabetes directly. I mean, there are others of diabetes. But having said that, I think the messaging is very clear in terms of reducing the sugar intake, because excessive amount of sugar intake do lead to weight gain. And again, as mentioned earlier, being overweight or obese often increase your risk of diabetes. So I think the messaging is easy for us to sort of tell Singaporeans to first cut down the intake of sugar, watch the carbohydrate intakes, and take a look at your other macronutrients like protein, fiber, as well as fat intake, to have a balanced meal instead of very sugar-laden or carbohydrate-heavy meals. I think that is the way that we should slowly sort of message to Singaporeans in terms of changing their eating habits.
All right, thanks very much for your time, Associate Professor Bee Yong Mong from Singapore General Hospital.